Welcome, everybody, to the Spiritual Emergence or Psychosis, exploring alternatives to non-ordinary states of consciousness. My name is Kyle Buller. If you signed up through the Psychedelics Today platform, then you're probably aware that I'm a host over at Psychedelics Today, and I'm joined here with Michelle Hobart. Michelle and I met at a Groff conference, and we've been doing some spiritual emergence work together, and thought this is a pretty relevant topic for people in the psychedelic community, but also for, maybe mental health workers that are working with people, say with like psychedelic use or just, any non-ordinary state. The trajectory of this will probably kind of go through, well, not probably, I'm sorry. It will go through like what's psychosis, schizophrenia, and then go into Groff's theoretical framework of spiritual emergence. And this is like kind of dear to my heart because I had my own spiritual emergence with a near-death experience when I was 16, and then I got into breathwork and some psychedelic experiences as well that brought on a lot of kind of crisis, psychospiritual crisis. And then I worked at a place called Soteria, which we'll get into a little bit in this webinar, which was a residential home for people experiencing early episode psychosis. Michelle, do you want to introduce yourself?
Sure, I'd love to. Thank you. So yeah, like Kyle said, we met at a Groff conference, and I had studied with Stan and Rick and all the folks, Brian, over in the Philosophy, Cosmology, and Consciousness Department at CIIS, California Institute of Integral Studies. So even before I had my own transformational crisis, my own spiritual emergence process, I had been exposed to this material, which was really helpful when I did have my SE in 2012 and 2013. And I was hospitalized twice in 2013. And so through that process, I really started to understand the inner workings of the mental health system, and really being able to bring alternatives and the psychoeducation about the way to hold these experiences, whether we're talking about non-ordinary states that are from entheogenic use, from meditations, or from spontaneous experiences, or like in Kyle's case, near-death experience. We're going to go through the categories of spiritual emergence in this talk as well. But suffice it to say that I was called to train as a therapist to be able to support other people through their spiritual emergence as well.
Yeah, and I'm also a grad student studying clinical mental health counseling and somatic psychology, and also kind of what was the push for this webinar. Me and Michelle have done this in the past, but also for a social justice course, I had to bring up like a social justice issue and present it. So, this has been like a pretty big topic of mine of kind of changing that narrative of psychosis and early episode psychosis and what schizophrenia is, and maybe moving along the lines of maybe these are spiritual experiences, or just maybe holding it as another way of framing what mental health is. So kind of advocating for more humane treatments for folks that might be going through this.
Exactly.
Awesome. All right, so introduction. Here's a nice quote by Stan. One of the most important implications of the research of holotropic states is the realization that many of the conditions which are currently diagnosed as psychotic and indiscriminately treated by suppressive medications are actually difficult stages of a radical personality transformation and spiritual opening.
Exactly.
All right. So schizophrenia, the term was coined by Eugene Bleuler, Swiss psychiatrist, and two Greek words put together, schizo and phren, so meaning a split between the mind. Sometimes I like to think about this from the shamanic perspective of maybe walking between two worlds. Just really quick, Michelle, do you see that like little pink line through the slides?
Maybe it's just I wonder what that is.
Yeah, I don't know. just showed up. All right.
Interesting.
Yeah,
It has meaning, I'm sure.
just appeared. I don't know what's going on there. That's fine. So yeah, schizophrenia, a split mind. So some of the symptoms in the DSM, how they diagnose it is, people that are experiencing visual or auditory hallucinations, delusions, paranoid thinking or thoughts, disorganized speech, or also grandiose thoughts. And obviously this is just kind of like a rough thing. It's not directly from like, because you have to meet like maybe 2 criteria of this, or, experiencing this for 3 to 6 months or whatnot. Do you want to add anything on this slide, Michelle?
Yes, and when we are describing this, it's important to keep in mind that the framework that we're talking about is the dominant paradigm framework of Western allopathic medicine, which means that a lot of the terminology in the first half of this is going to be what the spiritual emergence framework is a counterpoint to. So, but just by saying that, like when we say hallucinations, there's a way that we hold that as you'll see, we believe in the reality of these things as true experiences. So just wanting to honor that when these things that we're describing now are in this particular framework of Western medicine, and that's in some ways what can be challenging for some folks that are going through these experiences.
Yeah, awesome. Thanks for that. Very well put.
Mm-hmm.
All right. So psychopathology, what is it? This is kind of controversial if you're in the medical field, but, they're really just abstract ideas. Some of these aren't very scientific. They're kind of social constructs. There's no really specific gene for schizophrenia. There's nothing really biological there that people can find. It's not like, diabetes or cancer or anything like that. There's really no biological root there. Or at least, modern research hasn't really found that just yet. Some believe it's a complex interweaving of psychological, social, and biological factors. And others believe that, also could have roots in trauma. So, some psychotic symptoms in particular appear to be strongly linked to trauma. And I think some of that interpersonal neurobiology is really showing that with like Dan Siegel's work and some of this newer somatic stuff. It's really kind of trauma informed, and, you get into the realm of epigenetics and all this stuff. So
Exactly. I feel like bringing up also Eleanor Longden and Charlie Harriet Maitland from the UK and their work on compassion for voices, which really integrates parts work and trauma work in terms of how these voices are fulfilling different functions in the psyche. And that's not to say that they're not ontologically entities as well, like as a possibility, but that they're working with it in terms of trauma-informed care and parts work, which I think is really fantastic too.
Yeah. Yeah, and there's there's no really cure right now for schizophrenia, since we do kind of go off that biological model and we use medication. They haven't really found a cure, so most of the treatment consists of psychosocial and pharmacological interventions. So interesting that developing countries like the US actually have a higher rate of schizophrenia and than developed countries. And it's just really interesting that some of these say quote unquote less developed or indigenous cultures actually deal with this a lot differently. So going back to that idea that they're kind of social constructs, and that in these indigenous cultures, they actually hold this experience in a much different way and can help a person go through it, versus in, say, the Western culture, a lot of these symptoms are suppressed, and it's kind of scary, and people really don't know how to hold it. So it's interesting that these more developed countries have a higher rate. There's an interesting book by Arnold Mandel. He does process-oriented psychology, the Jungian analysis, I believe. But he had this interesting book called The City Shadow, and how kind of the culture in the city and the shadow of all that is kind of manifest mental illness. It's kind of a reflection of what's going on there.
Exactly. And I think it's also seen in research that a lot of the voices in the Western cultures and societies tend to be negative, tend to be sort of manifesting almost like inner critic voices. Whereas in other cultures, like you said, indigenous or traditional cultures, they may be neutral or beneficial. They may be seen as ancestors or guides and helpers that are supporting people. And I think that there is definitely a direct correlation between the Western culture and the way it's not allowing for these experiences, and then the way that turns inward in sort of a way of, like you said, the shadow and negative manifestations.
Yeah, definitely. It's like our cosmology just doesn't hold that. When something's spiritual, like the tree starts talking to you, and some of those indigenous cultures, that'd be a great sign. Maybe you're like a budding shaman or something like that, or the ancestors are talking to you, and that's normal. But yeah, our like philosophy or just perspectives don't hold that. It starts to look like quote unquote schizophrenia.
Mm-hmm.
And there's some research saying like how the early phase of first break psychosis it's really crucial for the further like development of the disorder and how people can recover from it. So some examples is looking at the research of the Soteria House by Lauren Mosher, Diabasis by John Ware Perry, and then there's a sister house, the Soteria Emanon, and then there's a few others that a lot of these houses got developed around the Bay Area, forming out of like the humanistic movement and some of the work that Esalen was doing.
Mm-hmm.
So the Agnew study, this was an interesting study that was funded by the National Institute of Mental Health. And I first learned about this at the Revisioning, what was that conference called? Revisioning
Revisioning
Madness?
Madness, yeah.
Yeah,
With
by
Michael Cornwell and David Luca.
yeah, which was at Esalen. And I didn't really know that Esalen had such a huge part in this whole framework until I went to that conference and really learned about it. And so this was a study, by the National Institute of Mental Health. It was the largest study examining schizophrenia and antipsychotic medications, randomly assigned double-blind study with Thorazine and a placebo in a medication-free environment. And their population was first break, early episode psychosis. And they had pretty high success rate. Over 70% of individuals were not rehospitalized, and a lot of them showed improvement. And so this study led to the development of these medication-free sanctuaries, such as Soteria House and Diabasis.
Mm-hmm. Yeah, and we'll talk more about the houses, both present and past, in a little while in the talk.
Yeah. Do you want to add anything on this?
No, go ahead.
Oh, cool. All right. So what is a spiritual emergence? Psycho-spiritual crisis. It was a coin. The phrase "spiritual emergence" is coined by Stan and Christina Groff. So it's kind of a play on words suggesting a crisis, but there's also an opportunity to use that crisis to emerge to a higher level of psychological functioning and spiritual awareness. I was going to add a picture of the Chinese pictogram of the letters crisis actually represents, is it crisis and opportunity? Mm-hmm. So suggesting that in these moments of crisis, there's actually an opportunity to work through the material and to transform in a new way.
Exactly.
Yeah. And this little quote was in a handout and quoted by Groff, and it was a handout that we got from the Spiritual Emergence training by Emma Bragdon. And it was just kind of wrapping up and saying, like, this is like a definition of spiritual emergence: the movement of an individual to a more expanded way of being that involves enhanced emotional and psychosomatic health, greater freedom of personal choices, a sense of deeper connection with other people, nature, and the cosmos. An important part of this development is an increasing awareness of the spiritual dimensions of one's life and in the universal scheme of things.
Mm-hmm. And just to kind of riff on that for a second, why it's so important to continue to share this message with different, sister communities, whether we're talking about the entheogenic communities, whether we're talking about Mad Pride, or really wanting to work with practitioners and therapists, is because of this time of transformation that we're in, and how so many people are having awakening processes through all these means, and spontaneously. And so to be able to share this framework and to share these ways is really important right now as well.
Yeah, thanks for that. And yeah, I really think a lot of people are starting to open up, with the increase of interest in plant medicines, especially with the increase in yoga and some of these interests in Eastern philosophies and practices. And even the internet, just people having kind of like these self-realizations with so much information. Like, people are kind of opening up, which then kind of can create, this crisis of, oh man, what am I doing? What's going on here?
Mm-hmm.
And that can really shift things in a person's life.
Exactly.
All right. So what's spiritual emergency? So this is like a spiritual emergency is, like I like to think of like spiritual emergence can be an intense process, but you're also grounded and you're kind of maybe in this quote unquote awakening stage, but things aren't as heightened. When it turns into an emergency, that's like when it can really look like maybe acute psychosis, or just really experiencing like an extreme state. So it might require a little bit more attention, more care, and it can happen pretty abruptly. And yeah, David Lukoff says, in spiritual emergence, there's a gradual unfoldment of spiritual potential with minimal disruption in psychological, social, occupational functioning, whereas a spiritual emergency, there's significant abrupt disruption in psychological, social, and occupational functioning.
Mm-hmm.
Yeah. So yeah, there was somebody that came to our house who was at a meditation retreat, and the retreat center couldn't really like hold them. They couldn't create that container, because it seemed like they were, I guess, like their boundaries started dissolving, and it just kind of came on really quick, and kind of looked like some sort of mania all of a sudden. And so they needed some like level of care where it could be contained, because it didn't seem like that place could really contain it. So they wanted to like give everything away and become Buddha, and which is fine, but
Mm-hmm. Exactly. So I feel like when we think about either spiritual emergence to emergency, or even take that continuum and extend it out further to so-called psychosis, then we can see like that it's moving along a continuum of what's possible to be integrated, what's able to be held. And so I think if we think about it in that way, and instead of maybe it being like this box where you have to check the boxes of, which side is it on, I think it slides, and sometimes even a spiritual emergence can slide into an emergency or back, depending on the amount of support.
Yeah, that's great. Yeah, it's kind of like a spectrum.
Mm-hmm. Exactly.
All right. Yeah. So it's instances of such confusion are not uncommon among people who become dazzled by contact with truths too great or energies too powerful for their mental capacities to grasp and their personality to assimilate. I think that's a
Mm-hmm.
really great quote, and
Mm-hmm.
kind of relates to say that experience of this person and this meditation retreat who maybe got a glimpse of something really profound and just really didn't know how to integrate it, and it just, the energy just kind of took over and got too much to handle.
Exactly.
All right. So triggers for spiritual emergence. Yeah, I think this is probably even goes beyond this list that we have here, but environmental, societal factors, job stress, living in poverty. Maybe your environment is just really constricting, which could create some sort of stress, and then a break of some sort.
Mm-hmm.
Um, Physical exertion, lack of sleep. I definitely saw that working with folks in residential. The lack of sleep was huge and definitely potentiated their symptoms even more.
Mm-hmm.
Um, Childbirth, miscarriage, and abortion, powerful sexual experiences can bring on, spiritual emergence, traumatic emotional experiences such as death, birth, breaking up with a loved one, any loss, divorce, separation or relationship,
Mm-hmm.
um, peak experiences, so maybe moments of self-actualization or realization through spiritual practices, yoga, meditation. I've definitely ran into some folks who have had a spiritual emergence process unfold after practicing a lot of Kundalini breath work. Um, and that can also, with the psychedelic drugs too, rites of passages, that could be a really profound experience for some. And then there's also some biological, physical trauma, infection, intoxication, sleep deprivation, as I mentioned, accidents, operations, near death experience like I had.
Mm-hmm. Mm-hmm. Exactly. So some of these are things that would catalyze experiences through maybe a trauma of some kind. And then some of them you can see are actually tools that are often used in different communities to induce altered states. So knowing that, like, the more that we and you'll see the list of different types of spiritual emergence, and you'll see how they all kind of fit in to this way of understanding that spiritual emergence is a wide umbrella that holds so many different types of non-consensus reality experiences.
Yeah. All right. Yeah. So this is kind of Groff's list of types of spiritual emergence. So the first one, shamanic crisis, shamanic illness. So that in shamanic cultures, say somebody who is about to step into the role of being a shaman or a medicine person, they might become very sick at a young age. They have a near-death experience. In that framework, it's like the spirits are calling that person into action, and by doing that, they're bringing them a little bit closer to death and madness to interact with that spirit realm. So, you could look at some of these as these kind of initiatory experiences, Kundalini awakenings, as I mentioned, practicing Kundalini yoga or meditation, where that energy is flowing through you and you're opening up those energy channels in your body. And then, what do you do with it once it starts flowing? It can bring on all sorts of different symptoms.
Mm-hmm. Past life experiences is a category that I opened a lot to initially through breathworks, having experiences of different lifetimes and how the traumas of those lifetimes were showing up in this life through patterns, or actually physiological experiences through clearing energy in the breathwork. And that also led me to doing work in the Akashic Records. So being able to see the multi-lifetime patterns and being able to clear and update contracts, really seeing how that affects the current incarnation, really being able to support people through being more fully resourced, more fully here, and bringing those gifts, as well as letting go of the trauma from past lives.
Mm-hmm. Yeah. Near-death experiences like the one that I had, I mean, that really opened me up to a whole new world. And I had a really hard time grounding after that experience. I fell into a huge existential crisis. I didn't really know what was going on anymore. And, I really didn't have a framework to work with. And I think that was the one thing that like messed with me the most, where I had this profound experience with death. And I came to accept it, and coming back here was just like, whoa, what is all this? And it wasn't until later I went to college to study transpersonal psychology, and one of my teachers was a shamanic practitioner. And I was telling him about this, and he's like, yeah, this is, it's just really upsetting that, if you lived in, say, a traditional cultures, the elder would have stepped in to teach you the tools that you needed to be able to work with this experience. He's like, but you didn't have anybody, luckily, somehow I had something telling me that like what I was experiencing was okay, and that like I just needed to get through it.
Mm-hmm.
But I really found a lot of grounding in books and reading, and finding other people that I mean, like Groff. I mean, his work was just so grounding for me. Ram Dass's work, and some of the Tibetan book of living and dying was huge.
Mm-hmm. Exactly. And talk about like the most existential place is when faced with annihilation.
Mm-hmm.
That really opened you to the realms beyond, and to really be able to continue in this life to integrate that and be able to share that and support other people. It's really powerful, and I'm grateful that you shared. Thank you.
Yeah. And it was really tough because like I was going to the doctors a lot, and they just wanted to put me on like a lot of anti-anxiety medication. And it was just weird that like, my primary like didn't really even suggest like therapy. Like when I was talking about anxiety, he knew like I had this experience because obviously I tell him I didn't have a spleen and all this stuff. But
Mm-hmm.
yeah, it's just weird not to process that and be like, well, yeah, you went through something really powerful. How did that change your life? It was like,
Yeah.
nope, like you have an anxiety disorder and we need to
Mm-hmm.
treat it. I'm just like,
Right. Exactly. And that's why it's like in these ways, like our souls are calling us to this work through our own lived experiences.
yeah.
It's almost like we can't not share about this.
Yeah, I definitely felt fortunate in the sense that something inside of me kept telling me like I was not crazy. Because
Yeah.
if that thing wasn't there, whatever that was, like maybe spirit or whatnot, like yeah, maybe it would have ended up a lot differently. But something
Yeah.
was like, don't talk about these experiences all the time with people, really know who you're talking to,
Mm.
and whatnot. But yeah,
Mm-hmm.
anyways. So episodes of unitive consciousness. So it kind of relates to Maslow's framework of peak experiences, and having moments of self-realization, self-actualization,
Mm-hmm.
and
Mm-hmm.
then psychic openings. So, that could look like being clairsentient and clairvoyant, kind of bringing in energy, just opening up, and maybe becoming a little bit more intuitive.
Mm-hmm. And that really speaks to the reframe of so-called auditory hallucinations or visual hallucinations, and in that it's giving it its own reality and validity by saying maybe what you're seeing or what you're tuning into are other realms that exist that you're now able to see or be able to hear or to be into contact with. And so, yeah, psychic opening. A lot of times the way that I understand so-called psychosis or spiritual emergence is really being able to work with these gifts that are opened in these processes, and being able to work with them and manage them and be able to share them.
Mm-hmm. So some other things could look like possession states or experiences with paranormal. I definitely was not a believer in paranormal experiences, and then I had some weird things start happening, and that totally shifted me. And I think that was almost like the height of my spiritual emergence process. Was having like almost weekly sleep paralysis, and on top of that, there like it's just like voices with it that came with it, and like just it was a really interesting experience.
Mm-hmm.
So,
Mm-hmm.
and then psychological renewal through the return to the center. So kind of looking at John Ware Perry's framework that he worked with at Diabasis. So he kind of took that Jungian approach, and he kind of had this theory that the psyche took like around 60 days to completely break down and rebuild itself. So, could look like this budding psychosis, but that was really the psyche and the ego breaking down so it could rebuild itself and kind of move towards a more whole self.
Mm-hmm. Exactly. And UFO encounters and abductions, that's something that Emma has also been getting involved with recently through let's talking about disclosure support and how spiritual emergence coaching, because UFO encounters are a category of spiritual emergence, we can include people that have had experiences with multiple different species of interdimensional or non-terrestrial beings, and in this time that's very common as well. So knowing that that's also those are experiences that also can need help and integration with.
Yeah. And then channeling, communication with spirit guides. I think that kind of ties in with, say, some of the psychic opening, and you could probably even relate that to some of the shamanic illness of being contacted by ancestors.
Mm-hmm.
And then the last one, drug addiction and alcoholism, being really caught up in that cycle. And I mean, yeah, things can definitely unfold if you're caught up in an addiction and using drugs all the time. And
Mm-hmm. And I think, Christina's work in this aspect in the addiction realm and her own recovery, and it really speaks to when Jung was in dialogue with Bill W., the founder of the 12 Steps, that he was saying that a spiritual connection is what these addictions are, what we're trying to reach for. And so I feel like she, included that in a really good way with the spiritual emergence framework to really understand not only the draw to not ordinary states and self-medicating or coping strategies, but also understanding how that can also dismantle some of the structures of the psyche and can need support in rebuilding from that as well.
yeah, and you're talking about Christina Groff, just to
Yes,
clarify for
exactly.
folks that didn't maybe catch that. And
Mm-hmm.
she actually,
Stormy Search for the Self, I think, was one that I really liked.
yeah, and she actually met Stan through that, right? She was kind of in treatment, and she was over at Esalen at the time. Is that how they met?
I can't remember.
Something along those lines.
Yeah.
Yeah, and something just came up when you were talking about the drug addiction. It's really interested in this guy Martin Practel, and Guatemalan shaman, but he always talks about this concept of hungry ghosts and how these hungry ghosts are maybe ancestors that didn't cross over, and that they kind of feed off the energy of the younger generations that are left behind, and pulling from that energy can create addiction and depression and all this stuff. And just it's interesting, like I always go back and forth. It's like, okay, hungry ghosts, it's also kind of along the lines of intergenerational trauma as well.
Yes,
Maybe
exactly.
different narratives.
Exactly. I think the more ways we can tell the story, the more voices we have that are sharing this process of remything or understanding something, the more people can be included in that. And I think it's really important to acknowledge, like you said, with this social justice component, that we're really trying to bring together these traditional holistic concepts, and really, while honoring the place of Western medicine, also challenging it and saying, it's limited in certain ways, and it has its place. And if it can be an adjunct to these other practices, that I think really my vision is a truly integral medicine that's holistic, that includes Western medicine and these alternative or complementary therapies.
Yeah, definitely. And something that I noticed working with people with, say, early episode psychosis and being part of this new project, Soteria, like I went in there with this spiritual emergence framework because I was like, oh man, this is so exciting to be part of a new house like this that's kind of embodying this. Because the whole concept was it was peer oriented and to just be with somebody through their process, and just having this background in breathwork and stands work, I was just like, okay, spiritual emergence. And like going in there, I learned so much that not everybody, like people in this process aren't necessarily going to relate to it. It's not going to resonate with them. Sometimes they won't have anything to do with it. And it's interesting as future clinicians thinking about this, to how to really navigate this framework and to use it with clients, but also not to maybe force it upon people.
Mm-hmm.
All right. So we touched on this a little bit, but just I wrote this. I had a little blog about spiritual emergence a while ago, and we just pulled some paragraphs from it. So yeah, throughout history, human history, mystics, shamans, religious leaders, priests, saints, spiritual teachers talked about and shared their stories of various spiritual, mystical experiences that they'd experienced. Some of these figures developed religions, philosophies, cosmologies, and guided societies by their visions and experiences. Many of these individuals were honored by his or her society because they were able to live with a foot in each world, so the spirit world and the physical world. And some of these individuals even brought back knowledge on how to heal disease, illness. Some of these folks were crucial for the survival and ongoing evolution of their tribe. If you're looking at, say, from the shamanic tradition, maybe the shaman would go into trance to see where the next the kill was of buffalo or their food source. They were the ones that were able to go between both worlds and access healing powers. And so throughout history, some of these folks were kind of like the guides of their communities. Their visions weren't necessarily suppressed and pathologized.
Exactly. And that reminds me too of even in the Greek or Roman traditions, that there were oracles, that these beings would come into contact and have visions. And so even in the early West, there was still a way, and there was still a place for the experience of divine relationship and intervention and guidance. So
yeah. Yeah, I mean, even just talking about like Greek culture and thinking about our Western roots, even the rites of passages that they had, like the Eleusinian mysteries and whatnot.
mm-hmm.
We don't really know what happened there, but we know that they kind of formed part of their culture, and they went on for like 2,000 years, and nobody really talked about them because it was punishable by death.
Mm-hmm.
Yeah, so in modern times, how we perceive it through the Western view. Many psychologists and psychiatrists are trained to kind of look at these visionary or spiritual experiences as pathology, product of mental illness, suggesting that there might be a biological root to what a person is experiencing. The current state of dealing with powerful or extreme states of consciousness usually consists of heavy doses of medication, antipsychotics, antidepressants. It's unfortunate that the mainstream psychiatry and psychology treat such experiences as so, But, you know, there are times, however, when medications and mainstream treatments are effective, and it's important to view these experiences through a different lens and offer different option to heal and move through such experiences. So,
Exactly.
not to fully discredit what we know, but also I think what we're really trying to say here is that we need a more holistic approach.
Hmm. Exactly.
Were you going to say something before?
Yeah, I was just going to say that I think you said it really well, that that sometimes these interventions, such as medication, or at least in the short term, things can be beneficial. And the spiritual emergence community is not anti-medication or anti-Western medicine. What we're saying is that there's a time and a place, and it's really about psychoeducation in terms of allowing people to realize that there are options, informing and empowering people to be able to make decisions, and to have the support to make those decisions. Um, and really, it's a way of being more inclusive instead of less inclusive.
Yeah, and when I was at Soteria, like when we were starting it, people thought it was like kind of anti-med, but we weren't that at all. It was giving a person options to whether they wanted to take it or not. And man, there were some times when people needed it. Uh, like they just needed something to get to sleep, or you know, especially maybe managing catatonia. You know, I definitely dealt with a few residents that were experiencing catatonia, and man, it seemed difficult for them. And you know, we didn't. There was points when we didn't even know if like the house was the best option for them. Like maybe they needed some sort of higher level of care. You know, it just looked like they were, you know, in a lot of pain at that point. And you know, we were questioning a lot of like, okay, what are we doing? Like, should we like intervene with more modern approaches if that person wants it? So
Hmm. And we'll talk about this. You know, I'll mention more about this when we talk about the houses. But you know, the Langian approach is really that treatment is how we treat each other, right? So it's about not having Western intervention, but having a space to actually be free to have those experiences and be in what you're experiencing without judgment, without intervention, and being there and being in community and being with people that can support you through it. And it is radical to think in that way compared to a lot of what we're taught in psychology. But it is something where we're returning to these sanctuaries as options, because we're seeing that it's really it's necessary, you know, for some to be able to move through the process, you know.
mm-hmm. Yeah, thanks.
Mhm. And yeah, I'll keep going. So, you know, another way that I think about it, not only in terms of the continuum or spectrum like we talked about before, but I think also we have to think about the context. And so for me, when spiritual emergence becomes an emergency, it's how it's held, perceived, or supported or not. So for me, the spiritual emergence versus emergency, whether it's reflected, contextualized, or marginalized, pathologized, oppressed, right? So it becomes an emergency by the way that the outer environment then reflects back what my experience is, for example. So spiritual emergence can be held in a way that honors the organic unfolding of the process, respecting the person, their own unique experience of reality as true, as valid, as vital, appreciating their own neurodiversity, which is a concept and a paradigm that is also, to me, goes really hand in hand with spiritual emergence. Knowing that the uniqueness of each individual is also subject to the same kind of pressures as other types of social justice issues, is another type of diversity, right? So when we appreciate our own neurodiversity, then we can come into contact, a true contact of souls, beings in their full expression of compassion and connection, trusting the process, allowing it to come to fruition, And sometimes it can come to fruition in a single lifetime. Sometimes it's a multi-lifetime process, right? Sometimes it takes, like the renewal and return to the center, sometimes it just takes a certain amount of time and you're through a cycle, right? Sometimes it takes months, sometimes it takes years. But knowing that it can come to fruition, and holding that internally, and being with the working through of these deep and powerful energies.
Yeah, thanks for that. And something you said about maybe being oppressed, or just like if somebody is like having a spiritual emergence and they're kind of okay with it and they share it, and then all of a sudden somebody wants to like just view that as negative and start suppressing that. I mean, that can really push somebody to then go into emergency, where they're like, you're not okay, you're not okay. When somebody's like, well, I just had this experience, like I feel fine, but I just want to talk about it. And then somebody just all of a sudden just starts like putting this negative spin onto it. And then all of a sudden it starts to turn into an emergency.
Mm-hmm. Yeah.
All right. Yeah. So this always used to come up in breath work. When I'd go to my teacher's house up in Vermont, they'd always talk about organic versus functional psychosis. I think this is like interesting to put out there, and I think also kind of talks about that holistic approach. So there could be psychotic features that arise from, brain disorders, from dementia, or maybe from an infection or fever. Another one could just be from like vitamin deficiency or B12 deficiency. Somebody that came into our house had an issue with their thyroid and was thinking that was causing some sort of symptoms. And, I think this is a good quote by Groff, stating, while mainstream psychiatrists generally tend to pathologize mystical states, there also exists the opposite error of romanticizing and glorifying psychotic states, or even worse, overlooking a serious medical problem. So I really think it is important, if something's going on for somebody, to get some blood work done, or, go see a doctor and make sure you rule out any, medical condition before even like thinking, oh, it's just like some spiritual thing that's happening or,
Right.
Yeah. Did you want to add anything to that?
Well, I was just thinking too about orthomolecular psychiatry. I remember that Emma had a great webinar on her website, IMHU. There's a lot of great webinars that are available, and one of them was on orthomolecular psychiatry. And I just remember like learning so much about all this actually different supplements or different molecules that we need, that if we have a limited amount or a deficiency in some way, that it might actually induce so-called symptoms. And so I think it's important, like Kyle said, to consider these things, and also like, hormonal shifts, and basically things that can be ruled out by Western medicine. It's important, to look at it holistically, and that does include the physiology. So.
Yeah, now there's a lot of research about gut biome and how that's affecting depression and anxiety in folks. I mean, it's like 95% of your serotonin's produced in your gut.
Exactly.
Yeah, so it's that's really important. And oh yeah, there's one other thing that I wanted to mention. Even if it could be, say, an organic type of symptom like emerging, say you develop some sort of hallucinations or something from an infection. I think there's also that role where you're like, oh, well, it's just an infection, like whatever. It's not meaningful. I mean, people can have very meaningful experiences in these, say, organic situations as well. And sometimes, if you're viewing it as, say, like the shamanic illness, or, just life intervening, getting sick, having like some sort of like thing arise which kind of brought you to a greater truth about life. And so, yeah, I think also not just like just saying, okay, well, it was just this thing that was wrong with you, because sometimes it can be really meaningful for people to go through something like that as well.
And I think that speaks to other types of conditions like chronic pain, and really looking at all of not just schizophrenia with very particular and intense kinds of symptoms, but things in the mood, so-called mood disorders, and depression and so-called bipolar and things like that, where we can really understand those kinds of cycles and those things and those experiences also in terms of meaning making and being able to hold it in a way that then you can really mine the gold from it and find out, like, what is it that is going on and what am I learning from those experiences?
Yeah, exactly. All right, so just a quote by Stan. If they, spiritual emergence, are correctly understood and supported, these psychospiritual crises can result in emotional, psychosomatic healing, remarkable psychological changes, and consciousness evolution.
Exactly.
And then just another one. Among the benefits that can result from psychospiritual crises that receive expert support and are allowed to run through their natural course are improved psychosomatic health, increased zest for life, a more rewarding life strategy, an expanded worldview that includes the spiritual dimension. Successful completion and integration of such episodes also involves a substantial reduction of aggression, increase of radical political and religious tolerance, ecological awareness, and deep changes in the hierarchy of values and existential priorities. It's not an exaggeration to say that the successful completion and integration of psychospiritual crises can move the individual to a higher level of consciousness evolution.
Exactly. And really understanding that on an individual level, we can be going through these processes to be able to bring forth gifts, to be able to bring forth our soul purpose, so that then we can, as a collective, be able to evolve our consciousness as humanity as well. I'll read this one. How about that?
Yeah.
We have observed that when these conditions are treated with respect and receive appropriate support, they can result in remarkable healing, deep positive transformation, and a higher level of functioning in everyday life. At present, the absence of such facilities and lack of support from insurance companies for unconventional approaches represent the most serious obstacles in effective application of the new therapeutic strategies. Yeah, exactly.
Yeah, and so here's some treatments to kind of bounce off that last quote by Stan. Soteria was actually a really interesting project that started. The psychiatric hospital in Vermont got flooded during Hurricane Irene, and they had to shut it down. And somebody wrote into bill that they wanted smaller community health centers. And this guy, Stephen Morgan, dug up all this old research from Lauren Mosher and pitched this idea to have a Soteria in Vermont. And, it's the interesting thing about it is that it's fully funded by the Department of Mental Health. Residents don't need insurance as long as you're a resident of Vermont there. And they can stay up to 3 to 6 months. And so it's just, that's just amazing to hear that the state is actually funding this project. You don't need insurance, kind of like as Stan said back there, the lack of insurance for unconventional approaches. And it's kind of amazing that the state is backing that, which I think is awesome.
Right, exactly. Another one in Vermont is Inner Fire, which is an anthroposophical and art space, so Rudolf Steiner's work. And it really, it combines working with the arts and working with crafts and working with somatics, and also getting people trained in different ways of giving back to the community once they're integrated in work.
Yeah. And I'll let you speak to the Center for Spiritual Emergence since you met, was his name Brock, right?
Brack.
Brack.
Brack Jeffries. Yeah, exactly. So I got to go to the center, and Asheville it's amazing what they're doing there. I met with Brack, the director, as well as one of the therapists who actually was trained at Naropa as well. And so what they're doing is it's a combination. They have inpatient and outpatient services. So right now they have, day treatments where they have groups, and they have being able to work with people in spiritual emergence and addiction recovery. And they also are working towards having more beds available for people who need longer term care as well.
Yeah. And the Windhorse Community Services, they're out in the Boulder area. We actually met a few of the people from that community at the Revisioning Madness conference. And they offer services not just to people experiencing schizophrenia. They offer a wide range of services in mental health. But, they just kind of embody, it just seems like that Boulder area, that Buddhist, guessing it's just very influenced by Naropa. So just more of a compassionate approach.
Exactly. And one of the things that I really took away from their work is that they have an entire team of people that are working with each individual. And so they're sort of holding space, and they're processing and sort of working with and working through and supporting each individual in that way. So it's very collective. It's, like you said, very, it's Buddhist, it's mindfulness, but it's also really understanding the collective aspect of working through a process too. Mm-hmm. And the Gnosis Retreat Center is a project that we are working on setting up here in the Bay Area, and that's a Langian house that is reminiscent of Kingsley Hall and the other Portland Road and other places in the UK and London. That the Philadelphia Association, which was R.D. Lang's organization, really trying to bring that back. And we're right now in the process of getting funding for that. And they're also offering in-home services right now for people as well.
Yeah. And there's also some other Soteria houses trying to pop up around the country. I know there's one that's been trying to get some funding in the UK, and then there's actually one I saw an article a while ago in Turkey that I believe is trying to get some funding and starting up. So that model's actually trying to expand. And then some of the places that use open dialogue, it can be really effective for working, say, with early episode Psychosis, which is really big over in Europe as well.
Yeah, definitely.
And then, as we mentioned in the past, there was John Ware Perry's house, Diapasis. There was a Soteria in Alaska. They recently shut down a few years ago. And then iWard, where Michael Cornwall worked, they actually worked with not even Soteria had admission criteria of, minimal exposure to hospitalization, minimal exposure to medication. But as I remember from Michael telling me, iWard, they had all sorts of different people, like violent, patients and whatnot. And
yeah, iWard was actually a ward, one of the wards of a hospital in Contra Costa County. And so once again, it was like one of these alternate spaces that was still funded and included in the hospital, but it was a separate ward than the main psych ward. And so they were able to work with people in a different way and without medication and moving through processes and things like that. So, yeah.
Cool. And so we're just wrapping up here, and just some resources if you're interested in learning more about spiritual emergence. There's the Spiritual Emergence Network and the International Spiritual Emergence Network, which got started by Groff. Now there's the Groff Foundation, which just got started back in 2014. At least that's when they had the meeting and really talked about it. And that's to kind of honor and keep Stan and Christina's work going. Integrative Mental Health for You by Emma Bragdon. So Michelle and I went through her training program. It's a 5-week course, and she has loads of wonderful information there. If you're interested in doing a spiritual emergence coaching program, she offers that. And there's a really great documentary that just came out called Crazy Wise by Phil Borges and Kevin, I forget his last name. But it follows, I think, 3 different people, and one of the main characters had a spiritual emergence process unfold after attending a meditation retreat. And it just kind of follows three narratives of people going through like a psychotic or spiritual emergence process. Really great documentary. I would definitely check it out. And actually on the site, they have a bunch of mental health resources, which is really awesome.
Mm-hmm. Mm-hmm. And in another way, honoring sort of this holistic health framework and the way that we're not only spiritual emergence coaches, but practitioners in these other ways. We also wanted to include setting sun wellness and becoming sacred space, which is my book that I wrote while I was in my spiritual emergence, actually. And so just to know that the intention is to really be able to support people with multiple modalities. Yeah.
Yeah, and then you have Hearing Voices Network, Mad America, and Icarus Project, which is kind of peer-run. And then David Lukoff has the Spiritual Competency Resource Center. And David has a really great story about his spiritual emergence, and has been writing about this topic forever. So it's a really great resource to check out. And so that's it for our presentation. Anything else that you wanted to add before we wrap up and head into questions and answers?
No, I feel really just honored to be able to share this and to be able to explore this with you and to everyone that came. I'm just so grateful for you and your interest and the way that it touches your own life. And thank you.
Yeah, awesome. Thank you.